Malaria is a parasitic infection. There are 4 different types of malaria parasites which are transmitted by mosquito bites. So it's not the mosquito that infects people, it's the parasites that they transmit. It's a very complex process of mosquito infection and transmission, and it has been we have known about this whole process for more than 100 years, and still we don't know how to quite prevent these infections. In terms of number of people, nearly 250 million people, that's almost 240 million people who are infected every year, and about 1 million kids, to be precise, about 627,000 deaths from malaria infections. So clearly it's a very important public health problem in need of effective ways to control the infection and to prevent transmission of the disease. mRNA vaccines we have seen in the last two to 3 years, especially the experience that we have gained with COVID-19 vaccination, that it has been a very successful platform. And so we decided to try this approach, and we were really successful. But so not only it can provide a very easy way to make vaccines, especially for a infection like malaria infections, but also this platform allows to combine. It's a very tunable platform so that you can combine many different vaccines into a cocktail. And you can use a cocktail of vaccine to satisfy the goals that we have set out for ourselves. That is to prevent infection and a vaccine to prevent transmission. So I think it's just the right platform for us to make a vaccine so that we can really target malaria parasites at different points in its life cycle. In the end, we are really hoping that this vaccine will find its way for human trials and perhaps lead to malaria elimination, or aid at least in the malaria elimination efforts at the global level. Now, although we are so far focusing on only one particular parasite species that causes more than 90% of malaria, let's say in Africa, and is also responsible for more than 90% of deaths in children from malaria infections in Africa. But there are other parasites that they are equally important, other malaria parasites. So we are also moving forward to include other vaccines that will target the transmission of other malaria parasites.